Hey everybody, so today's video blog is on the topic of tongue ties. So a tongue tie is a abnormal structure that lies underneath the tongue, like right there on the floor of the mouth. And it's basically a sort of a persistent remnant of development. So there's sort of this membranous thin structure that's between the bottom of the tongue and the floor of the mouth. And it kind of holds the tongue and prevents it from sticking out further or lifting up higher. And in certain instances, this can cause problems with either feeding or with speech development. So typically, when I'm seeing patients with tongue ties, they kind of fall into two main categories. So the first category are tiny newborn babies. So we're talking like a few days old up to maybe a month old. And in these newborn infants, the problem with tongue ties is it causes feeding problems, particularly with breastfeeding. It can cause problems with latching. It can cause excessive pain with breastfeeding for mom. And, it just causes trouble for everybody. The other group I'm seeing tongue ties in are usually like toddlers, like 2, 3, 4-year-olds. And in this age group, the problem is more speech development. And because the tongue is not able to move properly, certain speech sounds the child's not able to say or pronounce properly. So those are kind of the two main groups that I'm seeing tongue ties in. In the newborn population, it's somewhat nice because tiny babies, they're not aware of much of anything. So we can typically just snip the tongue tie in the office. And this, I think especially if you're a first-time mom or dad, this sounds a little bit scary. But in my experience, it's not a whole lot different than just getting a vaccination or a minor shot or something like that. The way that I perform this, typically we just swaddle the infant, and I have my assistant kind of help to open their mouth up, and we literally just snip the tongue tie with some scissors. There are other people out there, I think a lot of dentists who actually use a laser to do this. I think that's totally fine, but I don't think it's at all necessary. And just doing it simply with scissors, infants do fine with it. There's not really any problems at all in my experience of doing this dozens of times. Typically, the way it goes 80% of the time to 90% of the time is the baby is a little bit upset just from having their mouth pulled open and me looking at them. And once we snip the tongue tie and pass them back over to mom, they go right back to sleep. That happens probably 80 to 90% of the time. So it's something that's very easy to do in the office, and it pretty much fixes the problem immediately. In older kids, our 2, 3, 4-year-olds with speech development issues, unfortunately, 2-year-olds and 3-year-olds do know what scissors are, and they are not going to open their mouths to have their tongue tie snipped in the office. So usually in these older kids, we do need to put them under a brief anesthesia in order to perform the procedure of clipping the tongue tie. But again, even in these older kids, usually the speech development can then proceed as normal once the anatomic problem has been fixed. So anyway, I hope this was useful for you guys to learn about tongue ties and how we deal with them. And if your child has been diagnosed, I'd be happy to see them. Have a nice day.